This is the part 3 of the forefoot pain. This is going to be the treatment, and this particular part of the treatment will be one of the most important elements, which would be reducing the tension of his calf. And this whole calf attachment, as well as the windlass of his toes tissue, can be addressed by gentle stretching. If properly done, it's very effective in reducing forefoot pain, as well as other issues of the rear foot, midfoot. So John's going to be doing 2 different techniques, stretching his calf with knee extended and knee flexed. John's going to show how to use the active contract relax technique to lengthen his heel cord, and this will be with his foot pointed straight, as well as keeping his heel down all the time. John's going to go ahead and keep his knee straight first and work on this tissue right here. By keeping his heel down and by contract relax, he's pushing his forefoot against the floor without his heel coming off, and then switching back to putting the weight on the rear of the foot. So he's unloading, take the weight off the front, put the weight on the back, and then move over to the front of the foot with the heel stays down, and back to the rear of the foot. Don't try and lift up on that angle. Let the angle stay forward. So it's switching back and forth, forefoot, rear foot, and his heel does not come off, and he does it slower than he's doing now. If it's done incorrectly, the heel will come off. Also incorrectly is he'll let his foot turn out. Both of those will give a sense of a viewing that he's gaining motion, but he's actually not stretching his heel cord. The second one will be with the knee flexed. Same technique, forefoot pushing against the floor, and then rear foot against the floor. Forefoot, rear foot, and that gentle progression of stretch on the relaxation phase between forefoot, back foot. A third way of stretching will be with a little piece of material that we cut off our wedges, our 6-inch rolls that are half rolls. We put that in front and put his foot a little bit further back. And this is a cheap way of using a 4-foot wedge to get stretch into the flexors of his foot, long and short. And if that needs to be stabilized, you can put it next to something that doesn't move, or put his other foot in front. The same technique, but less force, pressing down and back, forward and back, but gently done. Okay, at this point we're having a liner from the patient's shoe, or lining material that we have in the clinic, and we have many types, and we can give you a reference later on for what type of liner would be helpful. We've already identified which part of his foot is painful, and we already have an ink dot on his liner, and we go to the back side and put a corresponding dot on this side with an ink to know where we want to relieve. We're going to be using felt to give relief and shift weight off his painful areas of his forefoot pain, and that will be with 5 or 6 different types of felt. Some can be purchased easily through My Foot Shop, which have a self-adhesive type of padding, or you can buy sheets of materials in rolls, would be even preferred, which would be 1/8 inch or 1/4 inch compressed felt. Knowing what you want to make would be helpful before you start making these, so depending on what finding you have, you can be looking at the top of the paper here next to John, and these will be the felt types that we can decide that might be better for his condition. So the number 1 would be just a linear felt that would be right back of his metatarsal first ray to load the pressure just back off his sesamoid bones. Number 2 would be a wider support to unload multiple heads of pain, and this is frequently with people that have erosion or wasting of their fat pads as they age or diseases, so that you're taking the weight into an area that's just off their sensitive metatarsal heads. This can be shortened and be producing something in the same manner with less felt. The dancer's pad is something that's real commonly used as well for the patient who has sesamoid or first metatarsal pain, so that you're actually loading just proximal to the lesser four toes and unloading the painful area of his great toe. Another favored one is to take the metatarsal that's painful and use materials on the medial and lateral sides to unload the metatarsal of pain. So this would be the painful ray would be third. This would actually go up a little bit under the head of the fourth and a little bit under the head of the second to take the pressure off the head of the third. And oftentimes, if you look at the plane of those heads, one of them will be depressed, so that the head will be closer to the foot or the floor, taking more weight than its neighbors. So this helps clear that out. The more common one is something that we find at the even department stores, which would be the teardrop style. And the teardrop is, as it decidedly seems like, is shaped like a teardrop. You put it on the back side of your liner. You would think you'd put it on the top of the liner, but often that gets shifted and ripped off as you put your foot inside your shoe frequently. It works just as well to affix it to the back side of your liner. And this is a nice separator to dome your foot to take pressure off your metatarsal pain. And you can make a little bit larger than an eighth and then skive off the edges to get more lift on this painful ray. This is a continuation of forefoot pain, and now we're talking about bunion pain. And often people want to have their bunion hallux valgus given some nighttime splint for comfort. There's two styles that are commercially available that I both have had some success with, but not total. The first one is the night resting plastic style that has a component of plastic with foam, forefoot stabilization for the 3-point stabilization to pull the toe into adduction or medial deviation. It's not very comfortable, and most people don't like it very much. This other one is very comfortable. It has a bit of a nylon hood that's strong nylon with a foam, there you go, piece of foam donut with an elastic that goes around the back of the foot, and it has a button on the other side that can be attached to different buttonholes depending on how long the foot is. This is very comfortable, and I've actually had patients, for lack of anything else, have used this repeatedly, buying several, 3 or 4 a year. They wear it in their shoes. It makes their foot feel more comfortable with gait. A more comfortable dynamic approach will be to use kinesio tape for flexible forefoot help for the bunion pain of the great toe. And this will be using a stretchy material. If you wanted to have a more firm material, you would be using leukotape and cover roll. I've used both, and both have value, although the leukotape stays on longer. All right, this foot tape job has been designed to give support for hallux valgus, to make his joint more aligned in his first MTP for better angulation of his tendons and have more comfort with his gait progression. So John has a tape job on his right foot. This tape is kinesio tape that we're using for John's hallux valgus to increase his function of his MTP joint in gait and stance. It can also be used for effective nighttime resting splint to give himself a little more medial angulation for comfort. This has been anchored here initially with almost completely around with his blue leukotape, his blue kinesio tape. We're coming back around his heel On his other side, we're anchoring it with a top dorsal tape, and there's another tape underneath on his plantar tape that gives support. Because it's stretchy tape, we don't have to worry too much about pulling his metatarsals together when we put the anchor tape on. If you use Leuco tape and cover roll, you have to be quite a bit more careful with taping the top of the foot, making sure that you're pushing your knee into the arch of the foot as you're putting that tape across the dorsum, so that you're having a full spread of his metatarsals medial-laterally when the tape job is fixed. On the end of the great toe, because it's stretchy material, we can go ahead and put a few small pieces around the medial side and underneath his toe to make sure that it doesn't come off too quickly. It doesn't do well if this tape doesn't stretch. You often can get a tourniquet effect of the great toe, and you're still watching for that even with this tape job, so that he has good circulation to his full toe. It doesn't do well with water in this particular design and this particular kinesio tape, so the other tape, if you're going to get it wet on your hikes or in your daily activities, would be better perhaps to use the Leuco tape. John, would you stand up on it and see if it stays on and feels good? And balance on one foot. And we're checking to see how it does for his balance and to see if his great toe blanches. Normally when this is effective, his balance will improve with this tape job, if he has a problem with stabilization of his first metatarsal joint. Another exercise that's really helpful for forefoot pain is relaxation and stretching of the tissues between your metatarsals. And I like to use some real commonly available items. I use a noodle that you can buy from a department store, and with a sharp knife go ahead and cut some slices off of that noodle, and then using either the half roll or in this case a book or a yoga pad, we can position his foot on that pad so that his heads are just off diagonally a little bit further back on the fifth than the first, and his knee is flexed 90 degrees, so bend it back. Good. Tip this, take the weight off a little bit so that you have a little angle like so, maybe back slightly right there, and put your padding between your toes. And you can put as much or as little as you wish. And if it gets thrown away by someone cleaning the house, you can make something else up with just some material such as Kleenex. The action is to pull over the edge of it without digging your toe flexors in so much. So it will be a lumbrical type of exercise where you're pulling down with the full foot stabilized on the block, and the toes being less flexed at the ends of the toes and more at the MTP joints. You can buy this type of equipment through a yoga store. This would be a yoga comb type exercise. And if we have too much, it won't work as well, so take one out and play with the remainder of your padding. Most people will find that it's hard to engage this type of action. They're used to using their toe flexors and not their deep muscles of their forefoot. So it is a re-education process, and it does tend to stretch between the metatarsals, and normally people say they love this exercise. Another way to use some equipment that's easily available for your exercise is to pull your big toe over on one side and then the little toe on the other side and have a dome under your foot. So this can just be working on a dome surface for a minute, and then switch that around so it's on the flat surface, and you hold the knee with your hand, and then move into pushing down and up, stretching out some of the muscles around the medial and lateral foot. Moving it the other way, working on stretching downward and forward. It's a very convenient post-op exercise tool to get people moving in different dimensions, different directions. You can also just tip it under the head again without the pads and work on flexing at the MTP joint with less DIP flexion. Some other items I use for toe pain, forefoot pain would be a piece of stockinette or a sock they can have at home. You cut a little hole on each end of the sock and use it as a non-stretchy material to give gentle mobilization of their MTP joint. And the instructions are to leave your heel down on the floor and move your forefoot very gently away and see if you can get a little bit of sense of stretch. It's a good exercise for gentle stretching and mobilization. Another technique I like to use is using a toe crest. This is one of the items that actually has had quite a bit of success. Patients come back and wish to have another. It's for extension problems of your proximal phalanx. So you put it under and you put the stretchy material on the part of the toe that's closest to the MTP. You take the stretch out, take the wrinkle out, and they actually wear that in the shoe, and the dynamics of it is that it helps pull down your proximal phalanx and gives the toe something to stretch out the distal portion. This would be good for hammer toes, perhaps less so with claw toes, but both would be benefited from this. Again, the hammer toe is when you have the elevated proximal joint bone and then the distal goes forward into extension. So this is common. The claw toe is when you don't have the distal portion of your toe going out into extension. It stays into flexion, so you're taking more pressure directly on the bottom of your toe, and you will have a callus right on that tip. The last thing I like to use is a water bottle that's frozen, so I just use one that has a concavity, freeze it up, and they can use that to put under their toes or under their forefoot to let it rest, and they can also use it to roll when it's full of cold ice. That'll make it easier for them to get a massage technique. They can also put it on the side so they can get a little tip on it when it's full. And that's been one of the successes for both the midfoot, rear foot, and forefoot. Lastly, it's kind of a buddy tape system. Instead of using tape, we put a 3-point device on one of their toes. And now you've buddy taped 2 toes together for joint sprains, as well as keeping some of the MTP strains more comfortable. This is easily adjusted, and it's not so constrictive that tape would be. And it also keeps a little bit of wicking between the toes. Otherwise, you have to put a little bit of soft bit of wool or cotton between the toes. Part of the forefoot pain for your clinic would be if you wanted to invest in some off-the-shelf items or refer your patient to a store that has off-the-shelf items that can be adapted if you need to with your padding or your posting. Some of these that are common but not necessarily totally the best would be over here on the German brand. It actually is made out of gel, and it has a very nice shock absorbing for your metatarsal head pain. It does have also a transverse arch, and it has pads for your heads, and they have different sizes. Unfortunately, I have to charge about 80 bucks for this, so it's pretty pricey. The other items are usually under $40, and there are varieties of them, and you can buy them for your own clinic through a variety of sources that will be listed later in the talk. But these are just two common ones, very inexpensive, shock absorbing style that would be out of the box, different sizes that you can trim with scissors. And there are so many of these that I won't even list them. Typically, if you go to a good sports footwear store or a work footwear store, you're going to have at least 4 or 5 varieties to choose from, either full length or 3/4 length. And if you wanted to keep just sheet material in your clinic, you can't go wrong with Spinco, which comes in the sheets that you can make either 1 or 2 for each foot, depending on how much room you have in the shoe. Something which doesn't last as long, but it's comfortable, as a form of plastizote. Again, this is a trilaminate of Poron and puff, they call it. They have different layers of materials that are very shock absorbing and comfortable that you can put in a shoe. This is again a softer one, typically for hypersensitive feet, which would be a very soft plastizote with Poron. You can also buy the Poron in 1/16, 1/8, and 1/4 sheets to put in a shoe. It doesn't last as long as the Spinco for sheer. There's other materials that you can buy, such as Acor, A-C-O-R, a store that has them both in the sheets and the wheels that come in a box wheel. So you can have about 6 feet of material in a roll that comes off in 4-inch widths that you can wear and cut off the length you need and make your own liner, or even an orthotic very quickly that's not particularly custom, but it does give good shock absorbing ability and allows you to have a base to use your padding to glue on or to self-stick. This is still on part 3 of treatment, using your office orthopedic supplies that you can apply to liners that the patient already has in their possession or something that they've purchased from a local store. It's usually pretty inexpensive, and you don't have to use custom orthotics to get the good effect, especially in the Alaska area where you have quite a bit of limited amount of resources and ability to get things on your feet in the right time frame. Today we have something that's called a yoga block over here, but if you use your books or your phone book, it works fine as well. It's just that my books were being worn out by having people's foot on them throughout the day, so I got these blocks, and I use them for a lot of other different things, so they're very comfortable. These are pads that can be placed in between toes. They also have gel pads as well as foam pads, and they're not as effective as you would hope, but in certain cases they prevent surgery using gel interdigital padding to keep the toes from crossing over when they have deformities. This is a roll of 1/8-inch felt, very, very useful. Every clinic should have one of these. We get these from AliMed. This is another roll of 16th-inch Poron, which is a very softening type liner. It's not real strong for wear, but it does give good comfort, and it does not bottom out like some of your plastizotes. This is a noodle that you get typically from your local store for swimming aids. Again, you have the toe crest. I get these from My Foot Shop, or in this particular case, Bird and Cronin, where they have different braces. The metatarsal pads, if you don't want to cut them out, they can be already pre-cut, different sizes, small, medium, and large. Some of them have stickum that you take the plastic off and you put them directly on the underside of your liner. Or you can use the buff, different sizes, right and left, teardrop, and you have to use some good adhesive and hold that adhesive away from one another for about 30 minutes to 40 minutes, and then self-stick them together, but they don't come off, so you don't want to make a mistake and try to get it off. They can also be reground a little bit with your grinder in your lab so that it makes a very nice product and it stays on forever. The other styles that are commercially available are internal metatarsal bars made out of felt, and they're at least over almost 5/16 high, and they're a little too big, I find, for most patients. So I use them as a picture, and then use my 1/8 inch or my 1/4 inch adhesive felt. And the 1/4 inch felt, you can easily pull it apart to make it whatever width and height you want by simply removing a layer of the soft material. You can also use this soft material and fluff it up to make a padding for a dancer's pad for your forefoot first ray, or between your toes where they have corns from hitting and crossing over one another. The materials of kinesio tape are easily obtainable. Leukotape, again, very easily obtainable. And if nothing else, you get all this now from Amazon.